When it comes to looking more youthful, sometimes the drugstore just doesn't do the trick. Instead, you've got to head to the doctor's office for some prescription beauty.
You can go and use over-the-counter products, and I recommend a lot of my patients to do that for maintenance care, to exfoliate, to keep your face moisturized. There are great over-the-counter products for those purposes. But when we get to a stage where we've got significant photo damage, sometimes we need to pull out the big guns and use prescription products.
For those with adult acne, putting your best face forward can be challenging. However, facial plastic surgeon Etai says that the topical prescription Obagi Cleansiderm is a great solution.
It's a 5% benzoyl peroxide, and the beauty in this product is that it's solubilized. So this benzoyl peroxide, it's not the type that you get over the counter. It'll actually penetrate a lot deeper into the skin and get to the root of the cause of the acne. With any of these products, you need to be using the product for at least about 6 weeks until you really start to see good results. But you need to be on the product long term for at least about 3 months to see the full effective results of these products.
Another condition that may need a doctor's attention?
Rosacea is an inflammatory condition, which we were not quite sure what the cause is. It's that redness, that inflammation that we get here along the cheeks, along the nose, and up here in the forehead region.
Almost 80% of people who have rosacea don't even know it, and they don't realize that there are plenty of treatments out there to help their condition.
Metrogel 1% is a product. It's a gel that we apply nightly in these areas. And again, it'll take about 6 weeks until we start to see results, but we see phenomenal results with the Metrogel. The other product that we have is Finacea Gel, but the beauty in this product also is that it'll help with pigmentary issues at the same time that it treats the rosacea. We have a lot of patients who have a lot of sun exposure, especially in warmer climates, and those patients will develop sunspots, freckling, and photo damage to their skin. Well, we have a great product for the dyspigmentation, for those pigmentary changes that you'll have on your skin, the sunspots, which is called hydroquinone, 4%.
Jennifer applies hydroquinone nightly. Dr. Funk also prescribed something for fine lines and wrinkles around her eyes.
Well, all the products we've talked about this far, Rebecca, work from the outside in. Well, this is a fantastic product because it works from the inside out. It's the only product that's been proven to stimulate collagen.
There's a great product now called Renova.
Renova has a much lower concentration of this tretinoin, of this retinoid. It's 0.02% versus 0.05% or 0.1% that we've seen for the Retin-A. And it's based in an emollient, in a moisturizer that really prevents you from getting that redness.
I've been using Renova for a couple of weeks and have really noticed a clear complexion and a more uniform look to my skin.
Another skin condition that needs medical attention is melasma.
We really see it in a lot of women who are pregnant or are having hormonal changes or have just started an oral contraceptive. And we call it the pregnancy mask, and we'll frequently see that through there. Well, we have a great prescription product for that as well. It's called Triluma, and this one combines the retinoid product, 0.05%, with the hydroquinone and a steroid. Well, why a steroid? To help prevent that skin irritation, that redness from that retinoid product.
However, Dr. Funk warns,
we want to take every precaution when a patient's pregnant. Therefore, I recommend they start using it after pregnancy.
And from clearing your skin to improving your lashes, Myra Golden came to Dr. Funk to help her grow her lashes, which were virtually invisible.
Maybe 7 or 8 years ago, I started noticing that my eyelashes were not as thick or as dark, and it seemed that I needed to wear mascara more than I used to.
The solution?
Latisse really gives you those long, luscious lashes you've always wanted. You apply it nightly, you'll see results at 8 weeks and full results at 16 weeks. Studies have shown that it'll lengthen the lashes by 25%, it'll make the lashes over 100% thicker, and it'll make their lashes 20% darker as well.
Women may want to grow luscious long lashes, but men also need some special attention. These skin products are beneficial to a man's appearance, but for men experiencing baldness, the pill Propecia gets to the root of the problem. When taken regularly,
in about 48% of patients, they saw regrowth of hair, and over 40% of patients, it prevented any future hair loss. However, we do always need to discuss some of the side effects. In less than 2% of patients, these side effects occurred, which were a bit of a decreased libido and an elevated PSA, which is a marker for your prostate. This product is not recommended for women, specifically pregnant women, because it can alter fetal development.
And Dr. Funk's last bit of advice?
This is your face you're dealing with. It's your social fingerprint to the world. You want to take care of it and you want it looking its best. So don't try and self-prescribe. Go see a trained physician who understands these products and can assess your skin and really knows which product will best treat your skin.